everybody. My name is 𝐃𝐨𝐧'𝐭. I'm a licensed marriage and family therapist in the state of California. I offer telehealth also as well to Colorado. This is my podcast, Therapeutically Aligned, where I interview clinicians around the country about the work they do in an effort to kind of humanize therapy and help people understand what we're doing and why we're doing it behind the scenes. To that end, I am just meeting Daniel today. I'm very excited to kind of learn more about his practice. Daniel, to the audience or for the audience, would you mind sharing your kind of niche, a high level, where you're located, kind of where you practice, what kind of populations you practice with?
Oh, sure. I work with adults, exclusively adults. I also exclusively right now I'm doing video therapy. I'm a therapist who I started like everybody else doing primarily online therapy after the pandemic, but then I stuck with it as a modality. I actually prefer it to in person. I am licensed in Pennsylvania and I'm licensed in Ohio, so most of my clients are there. Although I also have PSYPACT, which is a certification psychologists can get that allow us to do video therapy uh, in with clients from, I believe it's 45 states now. So I also have that as well. My specialization is in cognitive behavior therapy. My niche, I guess it would be that I practice cognitive behavior therapy, but more for people who are looking for more in-depth therapy. So it's cognitive behavior therapy, but not on a simplistic level like it's often presented online or in periodicals or whatever. So I I specifically practice what's called rational emotive behavior therapy. But like I said, my niche is for adults who are looking for exploring deeper issues than just maybe, symptom reduction.
Uh,
So that's my that's my niche area. I also do a good deal of forensic work.
Interesting.
So I do evaluations for the courts as well.
Very interesting.
I'm board certified in cognitive behavior therapy by the American Board of Professional Psychology, which is the specialization board associated with APA, and I'm on their board of directors. So I have quite a bit of expertise in cognitive behavior therapy.
Love it. Well, so I want to dive into that in just a minute, Daniel, but before we do, would you mind sharing with the audience of why did you get involved in this? Like why was what was your path to becoming a clinician and doing this work?
When I just really like understanding. I like the concept of therapy as a profession because I like helping people, but I like the idea that therapy did not present helping people as being this simplistic path to you fix one thing or you give them advice on one thing and there's and the problem solved. I like the idea of therapy being an exploration of the person and how the person is doing, an exploration of what they find important, recognizing both the person's strengths and weaknesses and taking them into account. I like the fact that psychotherapy, when it's effective, help people identify strengths, but also re- help them not ignore or lie about their weaknesses. Everybody treating themselves as human beings and finding a way to balance strengths and weaknesses to find the best path in their life. And that that interested me from the beginning. I actually started my specialization when I started out was actually geriatric psychology. I did a good deal of work with people who were dealing with issues related to aging and also issues related to cognitive impairment that often accompany aging. And from there, really loved the effectiveness of helping people deal with their thinking and how they were thinking about things and how they were approaching things, which led me to cognitive behavior therapy, and then I still work with older adults. It's just not my specialization. I work with people who from all the age groups, um, from 18 on. It just built on what I was doing, and then I started taking clients from different age groups. But it was this understanding that people needed to truly understand who they were if they were going to make any change. And I like the idea of therapy helping with that process.
Yeah. Yeah, I always think self-awareness is like the foundation for any therapy work or coaching work or any kind of self-exploration work somebody's going to do.
Right,
You have to
right,
have awareness of how you're showing up and what you're doing and to your point, what your strengths are, but also what your weaknesses.
right. I often have to tell clients will say, well, I think I'm figuring things out, but I'm not happier. And I said, sometimes the thing you gain from therapy is at least not lying to yourself anymore. At least you're being honest about what you're facing and how you're going to face it and what your strengths and weaknesses are when it comes to that.
Yeah. Yeah, I also think too, it's so hard for us as individuals to see ourselves. So therapy kind of holds a space where we're able to, uh, as clinicians, reflect back what we're seeing so that the person gets a little bit of a mirror into how others
Yeah.
might be experiencing them. Because sometimes it can be hard to understand why you keep getting the same reactions from people, but what am I doing? I'm not doing anything, but in reality, there's something that's coming across that maybe they're not aware of.
Yeah, exactly. And that's a major part of therapy. And I like that. I like that, the idea of helping people with that.
Yeah. So you mentioned a couple modalities there. Maybe we could start with CBT, and talk maybe a little bit about the limitations. Like you mentioned online, I'd love to kind of hear your perspective because I do think CBT is one of those ones that I practice CBT as well, but it does get kind of co-opted by kind of people that are not because the actual structure of it can be very linear or feel very linear. But
Yeah.
the reality is there's a lot of things that are going on behind that. So I do think that social media and people that maybe are not trained in it feel like they're well versed in it in some ways, but not always. So I'd love to hear your kind of take on, since you are, established in the CBT realm of
Right.
thoughts about it.
Well, it is interesting to keep in mind. So, cognitive behavior therapy, yes, I think has gotten much too simplified online. And it never, in my opinion, was never meant to be that. Um, what ended up happening, I think, as well, is cognitive behavior therapy. Some of the research, therapeutic research tends to be very sanitized in that it, everybody who's in a treatment group meets the exact criteria for the research was showing, make you can fix, quote unquote, the problems that are defined in the research in 20 sessions or less. Well, the insurance companies love that, so they grabbed that. That was like, 20. It's like, well, no, that's only part of it. But so cognitive behavior therapy itself was is just basically the idea. I I like this as a starting place, although it's also more complex. The philosophical idea that we are not impacted by what happens to us, we're impacted by our interpretation of what happens to us. So, cognitive behavior therapy is basically focused on how we talk ourselves through things, how we interpret things. And then the specific type of cognitive behavior therapy I practice, rational emotive behavior therapy, is looking at the degree to which the way we interpret things not only it affects how we think about things, but also how we feel about things. Now, I'll also tell you, since we're talking about my modality, is actually a combination of rational emotive behavior therapy and existential psychotherapy. I actually have a name for it that I've used in some publications. called Existential Rational Therapy, which is basically taking uh, taking an approach to thinking about things more rationally, but applying it to not only day-to-day issues, but also deeper issues that people run into. When I think about when I started getting comfortable with that approach, I think about a client I had who said, everybody keeps talking about meaning in life. What if life has no meaning? And I just looked at her, I said, what if it doesn't? And she got sort of surprised, and she said, what do you mean? I said, well, what if it doesn't have any meaning? How would you live your life that way? And it was interesting because what it ended up was getting into the idea that individuals need to define basically what meaning means to them. And that's a very cognitive process. So if you're sitting there saying, what is the meaning of life? Go ahead, try to answer the question. And therapy can often be a process by which you actually try to answer that. So existential rational therapy is taking some deeper issues that people what's the purpose of me going into work every day? Why am I putting up with this from my family? And going further and saying, okay, what's the answer to that question? Why are you doing those things? So, but rational emotive behavior therapy, cognitive behavior therapy, existential rational therapy are all forms of a type of therapy that are focused on how we interpret things and how we answer the questions that we keep asking ourselves. I will often tell people in therapy that when you are impacted by questions that you keep repeating over and over again, the best way to address that is often to go ahead and answer the question. Why am I dealing with this? Why are you dealing with it? And then to really find a true answer to that. So that's my view of cognitive behavior. It's very much about how people interpret things.
I love that framing. I've never heard it framed that way. I certainly have my spiel that I give people of how I frame
Yeah.
things, but I've never heard it explained that way. I also love the existential bit because I do feel like that comes up a lot in therapy. I'm
Yeah.
constantly talking to people about existential crisis. I joke sometimes that I could have a whole business of just 30-year-olds because it's like when somebody gets to around 30 is when they have these existential crises of, people are getting married and settling down and why am I
Yeah.
not? Or, some to these points of even the questions about work and things like, why am I doing this? What is the point of
Yeah.
this?
I I found myself. I think I was really helped with this because I started with um, geriatric psychology, and I with older people. And what was interesting is, like, I would have. I remember several clients I'd come in and they'd say, um, uh, the staff would be worried that they were suicidal, and it wasn't they were suicidal; it's they were saying they're ready to die, and they would say to me, "I'm ready to die," and I'm like, and I'd say, "Good, there's nothing I can do to stop that." The idea that we're all going to die someday, and I really got a lot of positive response, from people who were in their 80s and 90s, because I would say, "You're the only one who comes in and lets me talk about that." And so I think when you find a place where you are comfortable with talking about mortality,
Mhm.
everything else, all other existential issues fall into place.
Yeah.
And I, so I think that was and not, if I can make a distinction with cognitive behavior therapy and the way I practice and existential therapy, what what I like about the combination of existential therapy and cognitive behavior therapy is it treats questions like, what does it mean that my life has an expiration date? What does it mean that I can't find meaning? What is the purpose of what I'm doing? And puts it in a way that these aren't sort of just questions that are out there, but they're actual questions that have answers to them.
Yeah.
So I think that helps. I think I think they like the practicality of it while at the same time allowing them to address some of the deeper issues that they're having to face all the time.
Hmm. Yeah, there's a bit of uncertainty with some of those questions, right? There's this
Yeah.
uncertainty, and I could imagine having a space to explore that in a contained way, or feeling like there can be some sort of conclusion at the end that they can come to
Yeah.
grasp onto.
Yeah, what I have found in the writings I have about existential rational therapy is like take mortality. When people talk about that, they're not really always typically worried about what happens to them when they die. They're more often worried about things like, well, what happens to the people I love when I pass away? Or how do I deal with the fact that at some point everything I say that I'm not sure I want to do, at some point the choice will be taken away from me.
Uh-huh.
If I'm sitting here saying I don't know if I want to try for that another job, at some point the choice isn't going to be there. Life makes the choice for me.
Yeah.
So what do I want to do as far as addressing things right now
Hmm.
and finding meaning and purpose and things like that.
Hmm.
So again, it's taking deeper questions but making them practical.
Hmm. It almost sounds like giving agency back to them, right?
Yeah,
Like giving a person agency to make choices that are going to positively impact their life in whatever way
yeah,
they kind of see that.
yeah, and help them feel like they're living life in a meaningful and purposeful way rather than just trying to make it through every day.
Yeah. Yeah. Thriving rather than surviving.
Exactly.
Yeah. Okay, so what would a typical session look like? Is it organic? Do you kind of follow where somebody's going, or because when we talk about CBT, this is something I tend to do loose CBT as well, because CBT can be very formulaic, right? You do this
Mhm.
session in this way, and
Yeah.
all these kinds of things. I like the framework of it, but I tend to kind of myself stray from the typical, because I don't think CBT works for everybody anyways. Um,
Mm.
that said, how was a typical session for you? Is it more organic, or is it more kind of structured?
It's more organic, but it usually, I mean, I don't want to get a soapbox here, but I have the slightest idea where the idea of cognitive behavior therapy being formulated came from. I have the slightest idea, except that it sold books.
Yeah.
Like, um, I that must be it. It must be that because I've had people who have come into therapy and said, I read, well, I'm not sure cognitive behavior therapy is for me. I bought 12 self-help books and none of them help. I'm like, well, first you're supposed to read them and actually do the stuff and not what you're supposed to actually do. But also it's because I don't, because that's not therapy. That's a book. So the whole formulaic thing, I don't know where, because cognitive behavior therapy to me is not that. It I have a standard question. If someone comes in and says that they don't know, well, my question is usually some form, how are you feeling? And because that usually there's two things. One is it starts off the usual small talk, how are you doing? Which everybody, I establish that with the clients right at the beginning. It's like I don't ask that question because that gets a fine response. So I will start off by asking individual clients how they're feeling. And then what I will make clear to them is um, I will ask you how you're feeling because if you say you're feeling positive, then we want to look at what's working. Why are you feeling positive? And if it's negative, then that gives us something to look at. Okay, what should we focus on here? But also, it also allows them the opportunity to say things like, "I'm feeling good," and if I ask, "Well, what do you think?" Well, nothing bad happened this week.
Hmm.
That's like okay, and then that gives the opportunity to maybe press a little bit. Okay, it's not particularly effective if you are living your life based entirely on the way the wind's blowing.
Yeah.
In other words, I am in a good mood because nothing bad happened. This time of year around here, because I'm on the eastern side of the country in Pittsburgh, you get a lot of, well, I'm in a better mood because it's summer.
Mm.
Like, okay, but you have no control over the weather. So if you're living your life basically only on I'm in a good mood because the weather's good, then that's probably problematic. So what else do you think may or may not be working for you as far as how you're dealing with it? So it will start with that, and then when clients bring up, and this is of course a typical session being after we've established a rapport after the first intake and maybe even the first session. I'll ask them what they've run into and how they've been dealing with things, and then we'll look at the what sort of thinking they've noticed has impacted them and how it fits in with maybe what we've talked about, or maybe how it doesn't. Maybe it's something completely new. So there is a lot of uh, back and forth about what the person's been dealing with and how they've been dealing with it, and whether they think how they've been dealing with it has been effective or not effective.
Mm-hmm.
And then there's a lot in my sessions, there's a lot of me challenging people. And to the point you asked me, how I got into this, it was interesting because when later on, when people I knew personally, friends, family in particular, who I would describe what I do, which would be I challenge people's thinking and get them to challenge. They'd say, "Oh, that sounds like you argue with them." And I'm like, "Yeah." And they say, "Oh, that's you. That's right up your alley. No wonder you picked that profession." So there's a lot of, but I wouldn't call it arguing. I would call it back and forth challenging of their thinking, with the hope, and I'll tell people that even if they see it as arguing, I'm hoping what they do is they take what we talked about in session, how I'm challenging their thinking, and they start challenging their thinking on their own. In fact, when I can tell that therapy is going in a positive direction, it's when clients will start saying, I was bothered by something at work, and I thought this is what Dr. Marston would say.
Mm-hmm.
And this is how, and I was sitting there saying, oh, I don't understand why this is happening. And then I heard you, Dr. Marston, saying you don't need to understand something to decide what you're going to do about it. Or one typical challenge I will often present to clients is finding the best choice isn't the same thing as finding a good choice. If you're in a bad situation like a job you hate, every choice is by definition going to be bad. So people often get stuck because they're looking for the good decision. They're looking for the decision that has nothing bad associated with it. And I said that's already left the building as far as an option. So what you're looking for is looking for the best option can still mean looking for the least bad option. So there's a lot of that. There's a lot of confronting their negative thinking to help them think a little bit differently about that.
Yeah. Yeah, I love that you bring this point up. It's actually where I know therapy is working is when somebody says, "Oh, I heard you in my head, Kealy, telling
Yeah,
me XYZ, and so I made this other choice, or I thought about it differently." And I think, oh, all right, we're there.
yeah,
We're
that's
making
it.
change.
Yeah, exactly.
Yeah. Uh, so is there anything that still surprises you? I don't know. How long have you been doing this work?
Oh, 30 years.
30 years. So out of 30 years,
Yeah.
is there things that still surprise you about the work?
Is there things that still surprise me about the work? Probably I I still get surprised at how easy people think change is going to be.
Yeah.
Um, I'm not, and I think it's been incremental in the past 30 years with my, with the rise of the psychiatry profession.
Mm.
And if the pharmaceutical industries have done anything, they've done a really good job at getting across the message that your problems can be fixed by just taking a pill and things will be fine, and like really driven that home as a message.
Yeah.
And so it seems to almost have gotten worse, I think, between social media and the rise of the pharmaceutical industry. I've read, there have been more and more discussions I've read in different places there are more mental health professionals, yet why does the world seem more miserable than it used to be? And it does seem to be because there's a distinction between making real change and being willing to put forth the effort into it. When I was in graduate school, when I've been in practice for a while, so this was a while ago, and at that time, I went to graduate school in a place where a lot of people who had pretty big careers retired. So a lot of times they would get tired of being retired. So they'd go to my college and teach for like the last years of their life. So I got to meet a lot of people who had been in practice for a long time. And it was really interesting at the time to hear when they were in practice, so this would have been like 50 years ago, they weren't even required to give a diagnosis. This idea of putting everybody in this little box where you give them this name and that answers everything. You're bipolar, therefore that explains all your problems.
Yeah.
That wasn't how therapy was practiced. Therapy was practiced as, what are your problems? And there was more of a in-depth discussion
Mm-hmm.
of who you were as a person. And what, if there was a diagnosis, and I would tell people this when they come to see me, I'll say, I only see diagnosis as a starting point. The problem is people sometimes come in thinking it's the answer. That their diagnosis is the answer for their problems. And I say, no, it's the starting point. And in cases years ago, therapy wasn't even part of the process. It was an in-depth discussion of who you are as a person and what are the challenges you're facing.
Yeah.
So what surprises me is how simple people think real change can be.
Yeah.
Not everybody, but I'm just surprised by it.
It surprises me as well. I do think I agree with you. I think the social media, I think a lot of these big box companies, I think insurance
Yeah.
companies that want things that are measurable, all those things are fine on their surface. And
Yeah.
what's happened is this idea that there is a very cut and dry way to do therapy and that it is going to be moved, you're going to move the needle in X amount of sessions in this way. And uh,
Yeah.
again, that's measurable. And it's like it could be measurable, but it depends on the person. And, a lot of these things too, I feel like are self-report data. So, somebody might just take a assessment score when they're in a good mood and then in a bad mood, but that doesn't give you a full context of what's going on for them in real life and in their.
And it's interesting when we talk about existential issues, because I think that's the other thing I like about existential issues is because it 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 delves into the deeper thing. Like I remember people come in saying they're suffering from depression, and I'll just give them a little bit of background. Say, well, years ago when therapy started, depression wasn't called depression; it was called melancholy,
Yeah.
and melancholy literally meant something's missing,
Mm.
and that's a deeper sense of, you know, I've been I've been feeling sad 4 out of the past 7 days. I
Mhm.
mean, sometimes depression isn't even. It's a deeper. Sadness is definitely part of depression, but sometimes you get so used to it. Like depression can be, the depression can be that I've gotten used to it. That's the thing. So it's not necessarily that I'm sad 4 out of 7 days because I'm used to it, but it's the fact I'm used to my life being, eh,
Yeah.
That's the depressing part.
Yes.
It's deeper than that.
Yeah. 100%. 100%.
Yeah.
Well, so I mean, this kind of ties nicely into my next question, which is there something that you wish people knew or understood about therapy?
I okay, I'm trying to put it in a way that will not turn people off from therapy. Um, that one of the benefits, but surprises of it can be how much work it is. That you're the other thing, and I think years ago with therapy, from what I knew, one of the things about it that almost happened, although it might happen in different states, I think California might be different, is I think when people come in and they have to write a check for the amount of the session, they want it to be a lot of, they want it to be. So I think if you think about therapy as being, even if you're paying with insurance, I think it's useful to consider therapy. Pretend you're the one writing the check for the amount the therapist is getting. You would expect there to be a lot of work involved. Or else why am I writing you a check this month if all you're doing is giving me a worksheet and, or give me a checklist and giving me a list of things to say to myself. So I think people are sometimes surprised by how much effort and work it can be, but I think that's also a positive thing because it recognizes the humanness of it. Some people are turned off by the idea of therapy. They almost see it as immoral because they see it as, aren't you being too selfish if all you're doing is talking for an hour about yourself? And it's like, well, you are talking about yourself for that hour or that 2 hours a week or whatever, but you're talking about, if you've got a good therapist, you're talking about the good and the bad. You're at the same time uh, delving into the positives about your life and the positive about, but also the negative things about life. I'll give you an example, and this is I use this sometimes as a way of helping people recognize the complexity of therapy. People will be hesitant to talk about their parents. They'll say, "Well, I don't want to blame my parents," and I'll say, "Well, you're not blaming them, but tell me what you're going to say." Well, I promise you, I won't let you just blame your parents, but we'll use the information. And they'll say, "Well, they were this way, and then they'll say, but I didn't hate them." And so one thing I'll say in therapy is a way of reflecting complexity. I'll say, "Yeah, it'd probably be easier if you did, because if you did hate your parents, then you could just write off everything they did. Everything would be easy. Everything they ever did wrong, you could say, oh, well, of course they did it wrong. They were terrible people. That's why I hate them."
Right.
But you don't hate your parent. And that's what makes it complicated, because you've got to incorporate the fact that you loved them, but they were also human, which meant they messed some things up. And that's just an example of what I did to show that therapy is complex, that you often have to deal with a lot of conflicting emotions. So it is a lot of work. And I think people often are kind of caught off guard by that. They want it to be easy.
Yeah, I 100% agree and resonate with that answer for sure.
I
Uh,
will, I will often confront clients. I'll say, look, one thing I've learned as a therapist is people often don't want to change as much as they say they want to change. They say they want to change because you're supposed to say that.
yes.
You're supposed to say, I want to be a better person.
Yes.
Doesn't mean you actually want to put forth the effort to be a person. It means it's just sometimes just something you say.
Yeah. Yeah, I see this even because I work with couples as well, where one person is like, oh, but they're the problem, so I just want them to change. And it's like, well, you're both here. There's things that you're both going to have to change. It's just not,
Yeah.
it,
Oh, yeah.
not just about what
So,
everybody else is doing.
yeah. I stopped working with couples. I did. Because it's just an entirely different approach. Because in individual therapy, I will tell people if they're married and their spouse was the one, I'll say, look, my job here is not to save your marriage. My job is to help you be the best version of yourself you can be. If that means you stay in your marriage, great. I'm happy. But when you're dealing with couples therapy, that is the goal. The goal is to fix the marriage or whatever the relationship.
Yep, this is true. Usually, occasionally somebody
Yeah.
will they want to co-parent well or things like that. But yeah, for the most part, yeah, couples therapy is a whole different animal of work that you gotta do. Okay, well, so Daniel, a final question in this kind of clinical area is there a tool that we could share with the audience, something that's accessible or a way to think about things that we could just kind of share as a takeaway for people?
Do you mean a book or
It
a
could be a book. Some people give books, some people give, breathing exercises, some people thought exercises or
oh, well, I tell you what, I don't know. Can I give the name of another podcast
sure.
after you listen to Therapeutic Aligned? If you want to hear another podcast, the one that has helped me the most is a podcast called Philosophize This. And what I like about it is it's basically a picture everything you ever took and you ever heard about philosophy and imagine someone explaining it to you in a way that makes sense. And I really liked it because I've used it a lot in therapy. If I and I've told people if there's one thing you listen to, that's actually one I've as a therapist has helped me, and I think because it puts some of these deeper issues in a way that you can understand them. And I think there's really a connection when you realize, oh, the thing I'm dealing with every day, these philosophers who I thought I didn't understand were actually asking the same question.
Yeah. Yeah.
So,
I love
um, yeah, it's really good. I apologize. I forget the person's name who does it, but like I said, it's called Philosophize This. That's probably a podcast it's not a therapy podcast, but it's a way of looking at the world and a way of understanding some of these deeper issues. When I've written things about existential rational therapy, I've tried to make it clear that it's a way of taking these philosophical concepts that we've almost been taught to ignore because we're told they're too complex and to think about them in simpler, more practical ways.
I love it. I love it. I will
But,
share Daniel with the audience. I'll put it up on the screen so people can see it. I'll
okay.
find it because I'm interested too. Definitely want to put it that one.
Okay.
All right. Well, are you ready to kind of pivot here to be seen more on a personal level?
Yeah. Yeah. Now, this is the one I wasn't prepared for. I mean, yeah, so I'm ready. To say
I'm
I'm
nervous.
ready, again, a deeper issue. Define ready.
Yeah.
But, whatever. I think in my definition of ready, sure, I'm ready.
Awesome. All right. All right. So we're going to start out with an easy question, hopefully. What is something that is making you happy right now?
What is what is something that's big? Oh, that is easy. Pod being interviewed. See, see, that's going to seem self. That's going to say, oh, that was convenient. No, I did. I've been able to write a lot more. I've been able to uh, uh, get in, try to find interviews on podcasts.
Mhm.
Um, I've written books. I wrote an article for Psychology Today, and that's been pretty much in the past 10 years. Um, prim- Primarily because my kids got older. They're college, so the idea of always having to be around for the kids didn't have to do that as much anymore. So yeah, that's been so. This is making me happy.
Love it. Love it. That's great. Great answer. All right. Do you have a favorite app, like an app you like to use all the time?
A favorite app that I use all the time. I have every year for my birthday for the past several years, I, I've gotten a gift for myself from my wife, which is a renewal to the New York Review of Books
Oh.
app.
Mhm.
And I love it. And there's a couple of reasons. I love the New York Review of Books. I mean, that's just the thing. But I love that it's an app
Mhm.
because if I'm somewhere like at a party where I don't know any, I don't have to pretend like I want to talk. I just pull out my phone and I can read. So, read something I actually want. So I really like that app because, I still remember if you were taking a long bus ride or you were going somewhere, you had to remember to bring your book or remember to. Now I don't have to remember. I just pull up my New York Review of Books apps and read it. And I love it because you can go like when you subscribe to it, it takes you like you can go back to the beginning of their articles from the 60s. So
Wow.
it's fun. Yeah. So I like that. That's my favorite, both because of that particular publication and because it's an app.
Yeah. Love it. I'm gonna check it out. Okay, beach or mountains?
Beach. I don't like the mountains.
No,
I
not
don't understand. I don't understand the. I mean, I'm sure people love them. I shouldn't say that, but no, the beach.
fair. Fair. It's why it's the question, you know. We all have preferences. Okay, what's one thing that movies never get right?
Oh, hold on. I apologize. I was just complaining about this the other day. Oh, hold on. What is the one thing that uh um oh I hate this, but I can't remember a recent movie how close how personal therapists can get in their relationships with their patients. I mean, there have been movies. This was years ago, but it was a big movie, Prince of Tides. This was decades ago. Barbara Streisand.
Yeah.
Yeah, where there was a romantic relationship between them. Oh my gosh, she would have lost her license like within 15. How are you even going to argue that in front of the licensing board?
Yeah.
It's like, well, this, yeah, we're just give us your license here. We'll rip it up right now. Oh, they never get that. I mean, it's not that therapists don't care about their patient. I hate to say that because I think we always do, but this idea that therapists like it's that easy to cross over to be a friend or a romantic or sexual partner with a therapist. Oh my gosh, no.
Yeah. Yeah.
So they never, and I shouldn't say it, but they rarely get that. So I guess I'm making it rarely get that right. Sometimes they do.
I agree with you. I think most therapists have cited something about therapy and movies being
Yeah,
wrong. This is another aspect of it. And I see this sometimes with some of my clients who, maybe I've seen for a really long time that'll be like, well, can we just be friends? And I'm like,
yeah,
no,
no,
we can't. And I get where it's coming from because we do have this intimate relationship that is
yeah,
funny or, there's some humor that's come out or whatever. But it's a different dynamic and it would change the dynamic. And California, there's laws like you have to not be seeing somebody for 2 years before you could have
yeah,
any kind of. But I even had this on the flip side. I had a therapist of mine ask when I could be friends with her. And I was like, I don't want to be. I liked her, but I don't want
yeah,
to be friends with her. But I think
right,
sometimes this movie narrative that we can all, cross these boundaries, whether it's romantic or friendship, is
yeah,
not it's not reality.
yeah. Um, I remember I went to an ethics seminar once, and they said, because in Pennsylvania, you can't have any romantic contact with the patient for 2 years. And this person said, forget that. The answer to the question, when do you have a romantic, is never. Never, because even the 2 years like becomes a little iffy as to, well, you have to have had no contact with them whatsoever. And what's the likelihood that if you've had no contact, that they come back 2 years later?
Yeah.
So I've been waiting 2 years. It's like, no, they said. So I don't think people realize how big of a no
Boundaries.
that is in our profession.
Yeah, for sure. Okay, what's the best way to relax for you?
Best way to relax for me, um, hiking,
Ah,
but not in the mountains.
not in the mountains.
No, I'm not going in the mountains, but
Fair.
like I don't. There's a word for what I like to do, which is called urban hiking, which is you hike, but not in a place where you're going to get lost 15 seconds in. Like you can stop in the store and say, "Where am I?" So I like hiking. I love just going to. I love going towns I haven't been in and just sort of
Nice.
just walking for miles just to see what's happening. So that's relaxing and turning off the what is it, Life 360 or whatever it is, the apps where people can find you.
Oh, yeah,
I,
yeah.
I guess you just turn off for. I usually play music off my phone, so I can't turn the phone off. But yeah, turn off to any app where people can find you.
Yeah.
Yeah, that I like that.
Too many ways to track us nowadays.
Yes, exactly.
What is a dream trip location?
A dream trip location for me, it's uh in London.
Okay.
Uh, Now I have to say that's a dream. That's a dream, but I've been there. But I love going back there. I love going to London. Just the UK
Uh-huh.
in general. I mean, I'm going to London. I'm hoping maybe um, the next time we go there, we might go to Wales, just because I've never been to Wales and don't know anybody who's been to Wales. So, but yeah, the UK. I've been there a couple times. I love going back there. I just find it a fascinating place place to be.
Fair. Yeah. Lots of good places to visit there for sure.
Yeah.
Okay, what advice would you give your younger self?
Don't speak up more. I don't think I I realize that people don't know as much as I've gotten older. I realized people who sounded like they knew what they were talking about didn't know what they were talking about. I mean, I think I think I would want to speak up more.
Love it. I love that advice. I haven't heard that one yet. I think it's
Oh,
great. Great bit of advice for sure. Okay, this one's hopefully an easy one. Out of the four seasons, which is your favorite?
um, summer.
Summer.
Summer. I say that somewhat apprehensively because I might be changed. Summer to me used to be a my favorite only because my kids were out of school, so I'd see them more. And I guess it's still summer.
Uh-huh.
Just more time to just because it seems like that natural time to take time off. What is it? In New York City, I think that therapists there still take August off.
Oh, really?
Yeah. I don't know. I mean, it used to be that way because New York City, but yeah, I just like it's just natural time to slow down a little bit.
Yeah. Yeah. I always notice summertime is when everybody's on vacation and stuff. So even my business kind of slows down and I try to remind
Yeah.
myself to, enjoy the slow down. I hear you. Um, okay, what would be the worst superhero power to have?
The worst superpower here, the worst superhero power to have. See, this is a stand. Would if it was the only one you have, would be flying,
Oh,
because that's an argument. People, what good is it flying if I get there and I still can't do anything?
sure.
Like if the only power, so that's you know, I've been in discussion with people where it'd be like, well, would you rather be able to fly or be invisible? Well, I'd rather be invisible because what does it matter if I fly when I get there? I still can't do anything.
Uh-huh. Uh-huh.
So I don't know. that it seems like I think flying would be plus it'd be so noticeable.
Sure.
Like people would expect you to. I think yeah, I think it'd be unnoticeable because like if you watch Superman, like he didn't actually tell anybody he could do anything, but when he since he flew there by himself, people just assumed he could do something.
Right. Right.
So flying, I think flying would be the worst.
Great answer. All right, we got final two questions here. One, the first one is what would be an animal that kind of resonates for you?
An animal that resonates for me would be a pit bull.
A pit bull.
Yeah, we adopt. I don't know. I just we adopt dogs. We had a pit bull, and I. But even before that, yeah, I just, I, I like them.
Yeah.
So they resonate for me. They connect because they're they look really scary, but if you know how to handle one, they're actually quite gentle. Um, and plus, they're very gentle unless you mess with their owner, and then they're not. And I just kind of like that.
Yeah. Yeah, I love that. We adopted a big dog, a Mastiff
Oh
breed,
yeah,
um, January of this year, and it's interesting to me how many people are scared of the big dog
yeah,
energy. So now I have a better sense of, what people with pit bulls and other dogs
yeah.
go through with the
Well,
bigger.
when you own a big dog, and people tell you if they ask you that should I be scared of it, and it's like, well, no, unless you plan on messing with me, then I'd be very scared of it because they're not going to like that.
For sure, 100%. Okay, so final question here, Daniel. When you look back at your life, what do you hope to be able to say about it?
That he was helpful.
Hmm,
I think that's yeah, that he was helpful.
love it. Love it. Well, thank you, Daniel. You are officially seen. So appreciate you taking the time.
Great. Well, thank you very much.